While the number of babies who die before their first birthday is down, we still have a long way to level the playing field and protect all of our babies. According to a new report from Jacksonville University, for every 1,000 infant born in Duval County, about 8 of them will die before their first birthday. That is higher than the state average of 6 deaths. But as we know, 1 death is just too many. Joining me now to discuss this tragic trend, Faye Johnson with Northeast Florida Healthy Start Coalition. Good morning, Faye.
Good morning.
You know, I know your organization works with families and women even before they have kids or even consider them. You know, that is a crucial first step. What are some of the factors that you've seen here on the First Coast that get in the way of that healthy start?
Good morning, Melanie. Thank you for having me this morning. We see across the board the health of the mothers before they become pregnant is very important. The preconception health and some of the barriers that exist when our women are trying to get into prenatal care early, there are barriers that exist around that as well. But mainly what we see impacting infant mortality is the social determinants of health. And this is where people live, work, play, pray in some cases. And so when we see that, those are some of the challenges we see as our women explain to us just the level of stress that they're enduring and things like that. But we are working very, very hard across the community, not just in all of Duval, but to ensure that it's a community issue and the community needs to solve it.
Yeah, and I know that you have Magnolia Project there on the north side where women can come in and they can get either reduced costs or free health care. I want to kind of delve more into that environmental stress piece, Faye, because explain how that works and why certain groups and even certain areas, zip codes, specific zip codes see more infant deaths.
Sure. When we think about toxic stress, if you think about toxic stress, that's stress that builds over a time, over years. And when we think about women, there's a weathering effect on the body that's stress based on the environments where you live, based on the environments where you play, based on the environments where you work. Those conditions over a period of time, so that if you look at it like this, it breaks down the body. And stress can do that. High cortisol levels can do that. And so when we think about some areas of our communities, there's toxic stress, constant sirens, constant, things are occurring, constant, just all the way around. And so when we think about toxic stress, environment has a huge relationship to toxic stress, and toxic stress impacts the body long before a woman becomes pregnant and then while she's pregnant.
Yeah, that is a hard one to tackle, I know, because it requires kind of getting in the community and relieving some of that stress, which relates to so many aspects of their life. But I know Healthy Start Coalition works with dads. They can even get some support. Talk about some of those resources where you have access to these families.
Sure. Through the Northeast Florida Healthy Start Coalition, we have our Connect program, which is coordinated intake and referral, where any pregnant woman can come in for home visitation services and be assisted for those various supports. It's the parenting education, it's the health education, it's all of that, but it's also connecting her to resources, or the father to resources. We have our Fatherhood Pride program that works with the dads. When I say work with, they get them engaged in services and also some of the needed things that they need. But the resources, we have numerous home visitation programs that our women can get into. And also we look at trying to break down those access barriers and quality of care as well. So we just don't bring our women into the programs and then just leave it there. It's more than that. We have to work with our community. We have to work with our community providers to get them to understand the importance of the health of the woman before she's pregnant, while she's pregnant, and postpartum as well.
I love it, Faye. Thank you so much. Let's save the whole family, and then our babies will reap the benefits of that. NEFHealthyStart.org. Make sure you go to that website. If maybe you're listening to this and you feel like you could use some of that support and those resources, even if you're not even thinking about having a baby, great resources. Faye, thank you so much. I remember filling out that paperwork, my first doctor's appointment, and that right there connects you to those resources.
That's right.